Thank you for joining us today. My name is Jill Penn, co-president of United Campus Workers of Georgia. On today's call, we're going to talk about healthcare costs increasing for USG employees and what we can do about it. On August 14th, the Board of Regents voted unanimously to increase healthcare premiums and healthcare costs for all USG employees. These increased healthcare costs are unacceptable. Here's why. Through steadfast efforts of UCW members and our allies in the state legislature, USG employees received cost of living adjustments in recent years. But the salary increases have yet to make up for over 30 years of no COLAs and the more recent unusually high inflation. Let me give you an example. Today, an assistant professor who began with a starting salary of $56,000 on August 1st, 2014, would now make $66,560 with the recent cost of living adjustments added. But the inflation adjusted salary is $74,115.74. This salary is still the salary of $66,560 is still over $7,500 short of what the inflation adjusted salary should be in 2024. In effect, the assistant professor who started at $56,000 in 2014 has taken a $7,500 pay cut after 10 years of service to their university. There's no reason that state employees should have less spending power today compared to 10 years ago. It's estimated that the state of Georgia has approximately $10 billion in surplus funds. This figure does not include the mandatory rainy day fund. While it's true that during the 2024 legislative session, Governor Kemp and state legislators spent some of the surplus, there was still a lot left over. A reason the public was given for putting the brakes on spending was that there was an expectation that revenue from taxes collected in 2024 was expected to be reduced. We now know that Georgia's tax collections ran more than $2 billion ahead of projections for the FY 2024 budget year that ended June 30th. This is the fourth year Governor Kemp has significantly underestimated how much Georgia would collect in taxes. Governor Kemp has been hoarding our money instead of spending it to improve the lives of everyday Georgians, making our lives all the more difficult in the process. Let's look at the details of the health insurance costs. When looking at this slide, the first question I ask is, with over $10 billion in surplus, why isn't USG requesting more money from the state instead of putting the burden on employees by raising our premium 6 to 10% when they only gave us up to a 4% COLA last year? The money is there. And even though there's plenty of money, they're recommending that they make changes to our healthcare plan and increase employee premiums in order to reduce the increase or the request to the state. They actually put this in writing. They're saying the quiet part out loud. Here is the chart showing that all premiums, no matter which plan, no matter which tier, are going up. The amount to the left in each cell is the amount that will be paid and was paid previously, and then the amount in parentheses is the increase that will be paid per month. Now, the employer, USG, is also paying, increasing the amount they put in for the healthcare premiums, but you'll see that this is disproportionate, what they're asking from the employees. For one thing, you can see in the employer on the left, employee on the right, for all four plans and all four tiers, the percent increase in employee premiums is higher than our recent up to 4% COLA. And if we convert to percentage increase, you can see that for 3 out of the 4 plans, the percent increase in premium costs is higher for employees than it is for USG, our employer. So you can see if you compare on the left, the employer percent increase for consumer choice versus employee. Employees are paying 10%, employer 8.7, 8.8. Comprehensive care is the only plan of the 3 where USG is paying a higher percentage. Blue Choice and Kaiser, again, the employee is taking on a higher burden percentage-wise compared to USG. Now let's look at once you go and use your plan and you need to pay for the services. On top of premiums, they're also increasing things like our in-network deductible, our out-of-pocket maximum. For the consumer choice plan, there's a 6.7% increase for the in-network deductible, 6.4% increase for out-of-pocket maximum. For the comprehensive care plan, there's also increases, a 15% increase for in-network deductible, 16% increase for out-of-pocket maximum. To remind you, this particular plan, the employer was paying, taking on a bit more of the load, but then they make up for it here by the increase in network deductible, out-of-pocket maximum, increased costs for prescriptions. Then we come to the Blue Choice plan. It's getting worse. There's an 11% increase to see a specialist, 50% increase for outpatient hospital copay, 33% increase for inpatient copay, 20% increase for ER, all sorts of prescription increases, and a new copay if you need an ambulance of $75. And then finally, our 4th plan, the Kaiser Permanente HMO. Here, the deductible is going up by $100 or $200 for complex medical events, and prescription costs are also going up. To conclude, with a double-digit billion-dollar surplus, there's no need to raise healthcare costs for USG or other state employees. There's no need to continue understaffing our colleges and universities to the detriment of the quality of education we can provide our students. Bottom line, Governor Kemp refuses to spend the surplus, and Chancellor Perdue has failed to obtain enough money for the university system of Georgia, and it's having a negative impact on USG employees and the state of Georgia. This is unacceptable. Please use this QR code to sign our petition to let us know that you are interested in this healthcare campaign. Thank you, and I'll take any questions.